Welcome everyone. Thanks for joining us today. I would firstly like to acknowledge the traditional owners of the land on which we meet today, the Ngunnawal people, and pay my respects to their elders both past and present. I'm Megan French from the Grattan Institute. Grattan is a non-partisan think tank dedicated to contributing independent, practical and rigorous research and solutions to public policy debate here in Australia. We focus on 7 key policy areas which are vital to shaping Australia's future, including budgets and tax, energy, higher education, school education, productivity growth, transport in cities, and of course health. Today marks the parliamentary launch of our latest health report, a sugary drinks tax recovering the cost of obesity. I'd now like to invite Emma McBride MP to briefly address you. Thanks.
Thank you, Megan. Thank you to Dr. Stephen Duckett and his team for their important work on this subject and for bringing the nation's attention to the critical issue of obesity and preventative health in Australia. It is a pleasure to be here with my colleagues. I understand Senator Richard Di Natale is on his way, and Russell Broadbent. I come to this place as a pharmacist, someone who has devoted more than 20 years of their life to healthcare and who knows just how important it is to ensure that all Australians are able to live a healthy and happy life. As a pharmacist working in mental health, I have seen firsthand the consequences of overweight and obesity in vulnerable patient populations and have dedicated much of my working life towards improving physical health in mental health. The Grattan Institute has made an important contribution to the national conversation around overweight and obesity, and I welcome their commitment to creating a healthier nation. Prevention is better than a cure, both for our health and our health system. Living a healthy lifestyle reduces the risk of disease. A key part of this is improving the understanding of what makes for a healthy lifestyle and ensuring access to resources to support this within the community. The personal and social effects of being overweight or obese are devastating. Obesity causes around 1/4 of all type 2 diabetes and osteoarthritis. It causes almost 20% of heart disease and some cancers. Overall, obesity outranks tobacco and alcohol as a cause of chronic disease in Australia. Anything that we can do to reduce the incidence of obesity should be looked at. The report that the Grattan Institute has presented today calls for a tax on sugar-sweetened beverages. While such a measure will not solve the issue of obesity in and of itself, it may be able to play a role in changing behaviour and reducing the consumption of sugar-sweetened beverages, most of which contain no nutritional benefit and are heavily consumed by children. The Grattan Institute estimates that this tax would raise about $500 million a year that could go towards preventative health strategies, such as kitchen gardens in schools or school breakfast clubs, programs to treat obesity, research prevention and treatment of chronic disease, or improve primary health care or hospitals. The report also highlights the most important aspect of this tax, that it would also result in a drop of about 15% in the consumption of sugar-sweetened beverages as people switch to water or drinks or other drinks not subject to the tax. Ideally, a tax such as this would in time raise no money at all as people change their behaviour. As a health professional, I am proud of Labor's track record in healthcare and of our contribution to a healthier Australia. Labor in government established the Australian National Preventative Health Agency so that future Commonwealth governments would receive ongoing expert advice on promoting health and preventing disease. Labor too invested in keeping children, adults and communities healthy through the National Partnership Agreement on Preventative Health. Labor will be looking at jurisdictions around the world that have introduced a sugar tax to learn from their experiences, to examine the available evidence and seek the guidance of public health experts as to whether such a scheme could work in Australia. Once again, thank you to my parliamentary colleagues, to Stephen Duckett and to all of the Grattan Institute for their work on this report.
Thank you, Emma. I'd now like to invite Senator Richard Di Natale to address us. Very good timing, Richard.
It may be another division, so thanks for squeezing me in. Let me begin by acknowledging the Ngunnawal people as the traditional owners of the land on which we meet. I want to acknowledge Russell Broadbent and Emma McBride. Thank you for co-hosting the event. It's a great pleasure to welcome you all here, especially Stephen Duckett, the Health Program Director at the Grattan Institute. His contribution to and the Grattan Institute contribution to the health policy debate in this country is a very welcome one, generating new ideas, having really constructive conversations about how we make our health system better. And obviously today's topic's a very interesting one. It joins the chorus of experts and researchers calling for the introduction of a tax on sugar-sweetened beverages. So I'll let Stephen outline the findings of that report, but let me say a few words about it. Obesity is on the rise in Australia, and of course we know that obesity is associated with chronic illnesses like diabetes, heart disease, sleep apnea, the list goes on and on. In Australia we have 11 million people aged over 18 who are overweight or obese. That's 63% of the Australian population. About a third of Australian adults are within the normal weight range. And frighteningly, when you talk about kids, 1 in 4 kids aged between 5 and 14 are overweight or obese, and 1/3, 1 in 3, young people aged between 15 and 24 are overweight and obese. When you think about what that means, what it means in the long run is that we risk being the first generation that's going to hand down a lower life expectancy to our kids than we enjoyed. If you think about human progress and how we measure it, it's often defined by allowing people to live longer and healthier lives, and we risk being the first generation to rob our kids of that. And I think that's a pretty damning statistic. I can tell you also that as a doctor, I saw this issue firsthand. It's a complex issue. There aren't any simple fixes. It's one of the reasons I moved into public health and later into politics, was because many of the solutions to these really difficult, complex issues require a multifactorial approach, and many of the levers that we have are political ones. So let's talk quickly about the response here that's being launched. So the Grattan report launched this morning estimates that the cost of obesity on the budget's about $5.3 billion per year. It's a problem we're already paying for. We know that we need to act. We all understand that it's critical that we do act. We know also that there's no magic bullet, there's no quick fix, but we do know that some things work. We know that some things work. We know that mandatory and clear and transparent food labelling is effective. We know that restrictions on junk food advertising is effective. We know that we need to do everything to try and change the culture and environments in which kids grow up, to get people active and eating well. We need to design our urban environments so that they're environments that encourage and facilitate physical activity. But we also need to recognise that part of the problem here is the harm caused by sugar. A sugar tax, not a silver bullet, as I said, but it will have an impact, and the impact's likely to be concentrated on kids, who are the biggest consumers of these drinks by far. Today's report estimates that the tax, as they propose it, would raise about $500 million per year and lead to about a 15% drop in the consumption of these sugary drinks. What that means in practice is less diabetes, less heart disease, an impact on so many chronic illnesses, and greater life expectancy. So if we can improve our kids' health now and into the future, and we can recoup some of the costs of obesity, then why wouldn't we do it? Why wouldn't we take this on? And let's recognise, of course, that there are different ways that we can use that money. The Greens believe that all that money should be redirected into the health system. It's an opportunity to facilitate more prevention, more health prevention measures, which we know is cost effective in the long run. It's an opportunity to direct some of those resources into oral health, and the contribution of these sugary sweetened drinks isn't just about obesity, it also contributes to the poor oral health that Australians suffer from. So again, let me welcome the contribution by Stephen and the Grattan Institute. It is, as I said, a very valuable contribution to the national health debate in this country. The Greens are very keen to work with all stakeholders in moving this issue along. We'll make some announcements about that later on today. But thank you so much for your contribution, and really look forward to hearing your presentation. Thank you.
Thank you, Senator Di Natale. Finally, I'd like to welcome Russell Broadbent up to officially introduce Grattan's Health Program Director, Dr. Stephen Duckett, and there will be some time at the end for some questions directed at Stephen. Thank you.
Thank you, and you've heard from the pharmacist and the doctor, and I thank you both. My introduction to sugar was more like, sugar, da-da-da-da, honey, honey, you are my candy girl, and you got me wanting you. Sugar's not all bad. Sugar's not all bad, right? Sugar's been a part of our life. Too much sugar is a problem. And when one of my own doctor constituents came to me and said, look, we've got to do something about this. I mean, the reason I opened the way I did, you all look so glum. Obviously, none of you have any sugar, anytime, anywhere. And when you look at the clearness of the skin of our doctor at the head of the Greens, you know, he never has any sugar whatsoever, where I have lots. It's a very serious issue for me, for the Parliament of Australia, to look to the future of where our children are going to be and where our grandchildren are going to be. And if we don't address this issue now, we are condemning, as the doctor said, generations to obesity. And the evidence is everywhere. The facts are that our kids are drinking a bath full of sweet drinks every year, each child. Each child. So that's what we've got to think about. That's why I've opened the conversation. I know I came to introduce you, Professor, but I go back a long way with the Professor. I've been part of watching his activity over many years. And to see the report you have done, I've had some insight into that report. Stephen, we love the work you do, and it's my pleasure to introduce you to the microphone. Thank you very much.
Thanks very much for that, Russell. I was in the choir that won the City of Sydney Eisteddfod.
Very good too, though.
But I was a soprano.
They were no good after you left, though.
I was a soprano in those days, and I'm not proposing to emulate your fantastic introduction. I'd like to acknowledge the Ngunnawal people, the traditional owners of the land, and to remind us that those acknowledgements of country are really important because Aboriginal people today have a life expectancy which is 10 years shorter than non-Aboriginal people, so it has real meaning today. It's great. I'll run through the report that we issued today. Copies of the report are there. Why did we look at this? We looked at this because of the obesity epidemic. 25 years ago, less than 10% of the Australian adult population was obese. Today, it's almost 30%. 20 years ago, less than a couple of percent of kids were obese. Today, it's almost 7%. We are increasing our obesity. And why are we doing that? Basically, activity levels are not changing or maybe slightly going down. What's happening is we're consuming more. We're drinking more different drinks and consuming more sugar-sweetened drinks, amongst other things. And so that's why we decided to look at this issue. We recognise that what you eat, what you drink is your own decision. You make that choice, you live with it. But in making that choice, you're also incurring costs that other people have to face. We estimated that the cost of obesity in Australia is more than $5 billion to the taxpayer, $5.3 billion. And this comes from another MP, welcome. The cost comes from people who are obese using more GPs more, using hospitals more, using more prescriptions, being more likely to be on social services, being less likely to be employed. And these are the costs that other people meet. These are the third-party costs, the community costs of these consumption decisions. And of that $5.3 billion, we estimate, or others have estimated, somewhere between 5 and 20% of that is due to sugar-sweetened beverages. We estimate in the mid-range about 10%. Now, what we know is that a significant proportion of our daily intake is coming from these so-called discretionary foods, and it's quite high. And more importantly, a significant proportion of our sugar comes from beverages. If you look at that, look at the teenage bar, about almost 30% of the sugar intake for teenagers, 14 to 18-year-olds, come from soft drinks. For 19 to 30-year-olds, more than 30% come from beverages alone, and over 20% come from sugar-sweetened beverages. So this is a particular issue that we have to address. I said that. So our recommendation is that we should actually place a tax on sugar-sweetened beverages to try and recoup some of the costs that are caused to taxpayers. And what's important is these sugar-sweetened beverages, water-based beverages, have no nutritional value. They are essentially empty calories, and that's why we're focused on those and not some of the other drinks that also contribute to sugar consumption. we might be derided as this is a nanny state intervention. We are not. This is not a nanny state intervention. Sure, it has some impact on consumption decisions, but we're saying that is not what we're on about. What we're on about is making sure that people who cause these costs, who are incurring the costs for everybody else, takes them into account. So we've cast our report not in the nanny state mould. People's decisions are their own decisions, but we also need to look at it. This table is the list of jurisdictions which have introduced sugar state beverage taxes already. When we started this list, it was a very short one. Every week we have to add a new jurisdiction. Just a couple of weeks ago, at the same time as the US presidential election, there were 4 other cities and counties that added a sugar sweetened beverage tax by a popular vote to be introduced. And since the presidential election, another one, Cook County in Illinois, has added a sugar sweetened beverage tax. What is really interesting is what's happened in England. So the UK, the Conservative government has introduced a sugar sweetened beverage tax from 2018. And what's happened already is Tesco, one of the largest retailers in the country, has announced they're going to reformulate all their home brands. So they're reducing their sugar intake. So the sugar tax is actually having an impact before it is introduced. And this is a win-win for everyone. This is a win for consumers, and it's a win for Tesco because they're actually ahead of the game. So our proposal in brief is 40 cents per 100 grams of added sugar. So the more sugar is, the more tax, the less sugar, the less tax. So it encourages reformulation. We expect it to be fully passed on to consumers. We'd expect the impact to be about a 15 to 20% drop in consumption. It would raise about $500 million in the first year and about $400 million in subsequent years as people change their behaviour. What we do know is it works. It works because people change their behaviour. They recognise the price signals and it changes the behaviour. We'd estimate a small reduction in obesity prevalence as a result. And, you know, this is just an excerpt from one of the studies. This is a study of Berkeley in California, which introduced the tax in 2014. Bearing in mind, just across the bridge, there are counties which are adjacent to Berkeley which didn't introduce the tax, so people could avoid the tax by going just across the county line, Oakland or San Francisco. But nevertheless, even so, there's been a change. And of course, Oakland, I think, was one of the counties that introduced the tax a couple of weeks ago. So what we see here on the left is that the consumption of sugar-sweetened beverages in Berkeley reduced between the pre-tax and the post-tax, where it didn't change in the comparison counties, and consumption of water dramatically increased, where it only increased slightly in the comparison counties. So we know that this is a tax which works. And what is the impact going to be? The impact is going to be on a 1.25 litre flavoured mineral water, probably 35 cents, on a 2 litre soft drink, probably 80 cents. And so there will be an impact on price, and the evidence from overseas is that indeed the manufacturers pass these taxes on. This table is in our report. So what should the money be spent on? We haven't said what the money should be spent on. We've said you could spend it on health or health research, you can spend it on obesity prevention programs. In fact, every time a tax like this has been introduced overseas, some of the money has gone on obesity prevention, especially amongst children. And you could also have it go towards budget repair. So it's important to say, as Richard said earlier, this is not the silver bullet. This is not the answer to the solution of obesity. It is part of the answer. We've tried over and over again to have advertising campaigns, to tell people to eat better, and it hasn't been working. We know also that it is regressive, but what's important is the total household spending on beverages, all beverages, not just sugar sweetened, all non-alcoholic beverages, is less than 1% of household income. So the regressive effect is very, very minor. But what's also interesting is that the benefits are also pro-poor, that low-income people do consume more beverages, sugar-sweetened beverages, and so would benefit more by changing their behaviours and substituting for other less taxed benefits. Now, of course, we can't actually fully estimate the regressive impact because we don't know how the money's going to be spent. And so it depends how the money's going to be spent, whether it's going to have an impact. There will be a small impact on the sugar industry. Most of Australia's sugar is exported. 80% or so of our sugar is exported. And the remainder, some of it is for sugar-sweetened beverage, used for sugar. The Australian sugar is sometimes used for sugar-sweetened beverages, sometimes for cakes, sometimes in packets that you buy at the supermarket. So if you think about it, what our estimate is, if you look at it, that's the regressive. So what you see here is that the lowest income, the lowest fifth of the population spend about 0.75% of their household income on all beverages. The highest fifth of the population spend about 0.45% of their household income. So there is a regressive effect, but as you can see, it's actually very, very small. In terms of sugar, about 80%, these are our estimates, about 80% are exported. In the future, another 17% or so will be for domestic consumption, not sugar-sweetened beverages. A couple of percent will continue to be used in sugar-sweetened beverages because not all of the sugar-sweetened beverages will disappear off the shelves. And about 1% is the remainder, which would have to be redirected to exports if we're going to continue the same level of sugar production. So, in sum, that's what we're proposing. We want to recoup some of the costs of sugar-sweetened beverages. We're proposing this tax, which will bring in 500, dropping to 400, and change sugar-sweetened beverage consumption by about 15 to 20%. And we think this is going to be an important contribution to at least slowing the growth in obesity, hopefully bringing it slightly down. Thank you very much.